all of you can please be on mute and turn off the cameras as well so that we can have an uninterrupted relay and discussion between Bhavna and Dr. Glossy. So Divya, we can prepare to go live now.
Yes, I've switched it on.
Okay, over to you, Bhavna and Dr. Glossy.
Thank you so much, Rinki. Thanks a lot. So a very good evening and a very warm welcome to everybody joining us today for Need of the Hour. This is a CII IWN series that we have launched given the COVID situation. We want to bring you quality information, valuable information, and information that can actually add meaning to where you are right now. So with that said, we are very pleased to have with us this evening Dr. Glossy Sabharwal. She helped kick off this event as well with us on Tuesday, and she's been with us yesterday as well, and she will be here tomorrow. This series is actually just around addressing your questions. So Dr. Glossy is going to address all the burning questions of the hour, and we'll make it a live interaction. And while we wait for the questions to come in, I just want to say a warm welcome to you, Dr. Glossy. Dr. Glossy is a leading radiologist. She is with Jeevanmala Hospital and Apollo. Dr. Glossy Sabharwal, a warm welcome. Please unmute yourself.
Thank you so much, Bhavna and CII. I look forward every evening after day-long work and night work to this beautiful session where unending questions come, and I love to interact. Okay, so...
Okay. Dr. Glossy, while we're waiting for everybody to start writing their questions, can I start with some of my own, please?
Please.
So actually, the burning question I have for today is around plasma. It seems to be that plasma and oxygen have just been, they're just more valuable than gold right now. Can we specifically focus on plasma? Can you tell us what is plasma therapy?
Bhavna, absolutely, you have put on spot on. It's like more valuable than gold. Now, plasma, when we say what is plasma therapy, it's not something new. It's been used, it's an age-old procedure used to treat viral infections.
Mm-hmm.
The blood of the recovered patient is taken and antibodies from them are used to treat viral infection like any other viral infection. That is what plasma therapy is.
Okay, all right. So it is used basically to help treat viral infections. So why is it being touted as like the next best thing? I mean, since white bread, why is it so amazing right now?
I think I personally feel I'm working with my hospital, with Apollo, that it's a little too hyped also. Because if you say that, is this the Ramban for COVID or it'll save you, it's not proven to be like that.
That's exactly the whole point. Everybody, all the doctors are saying that it's actually rubbish, and yet everybody is going after plasma. So we're still wondering why. Why is that?
We have to first understand what exactly plasma does.
Yeah.
Right. So plasma basically has, it's a blood of a recovered patient. Now, a patient who had COVID had antibodies during that time. So we take out the blood of that patient and we extract the plasma from that blood, and that has antibodies. Those antibodies will be given to the patient who is transiting from mild to moderate condition or moderate to severe condition, and we give the plasma. In some cases, it is very effective. Why? Because the timing of plasma giving is very important. How do you know when to give it?
Yeah.
We don't know. So that is where the question mark comes.
So if it's a good therapy, so is it determined by the condition of the person? Is it determined by the stage in which you give it or the date in which you give it? That is going to determine whether it works for somebody or not. Is that what?
Yes. What stage of disease you are in. But there is a catch here, Bhavna. If I know today my patient is in we all know by now that there are 3 stages of COVID: mild, moderate, severe. If I know my mild patient is going to go into moderate and I give plasma, it is going to be effective. If it is in moderate and going to severe and I give it, it is going to be effective. But can I actually predict? No, I cannot.
Okay. Are there any success groups that we've seen, like certain age groups where it works?
See, it has not been very well. There are some studies which have shown that yes, this much percentage of plasma therapies have done wonders, but not a substantial research. So there is nothing as of now that, okay, you give plasma, you save the patient. There are medicines, there are drugs happening side by side. So you've got remdesivir, steroids and plasma. So which has acted? We don't know.
Difficult to tell. Okay.
Exactly.
And what is the criteria for actually giving plasma? Because again, there's this whole gray area around it. What, can you just share some light on that, please?
Anybody who had COVID in the past can give plasma within 120 days.
And women, there's so much debate around women cannot.
So women who have had children ever, like they've conceived, they had children, they cannot ever. If you were pregnant, you cannot, because once you get pregnant, you develop HLA antibodies in your body, and those antibodies cannot be given to the patient who has COVID-19 infection. So that is why women who have had children or are pregnant cannot donate plasma. And there are other criteria that where you cannot give plasma.
Okay. So if you, so women who have been pregnant, whether they had a child or not, even though maybe they had an abortion, maybe they got pregnant and then whatever, miscarried or anything. So nobody can give. If you had a pregnancy, you cannot give.
Yes.
Is there any age criteria? Is there anything else that determines?
So ages between 18 to 65, they can give. If you have had your vaccines, you cannot give.
Okay.
You know, so like this, there are many other criteria. If you have diabetes, you have blood pressure, you cannot give the plasma. You cannot donate. Yeah.
Okay. And also now there are so many, because it's the new gold, plasma is the new gold. One hears that now there is a plasma center khul raha hai, yahan pe donate kar dijiye. I mean, how, I don't know. Can you just tell me, like, is this legit? Is this something people should be going and just giving plasma anywhere?
See, plasma is, after all, it's like you can, I always give the example of a blood transfusion center. What do? You go and donate blood, right? We have been there, it's been there that you go, you donate blood. It's like that. So any procedure that involves blood also involves the risks with it. The risks that you can carry, the needle infections that you can carry, and those are the deadly viral infections. The deadly viral infections like hepatitis B, hepatitis C, hepatitis D, they can be transmitted. You cannot go to any center and just, give plasma at any place. It's not like that. We have to make sure that it's either in a hospital setup or it's a registered center where you're giving plasma, and that's how you go about it.
Okay. Wonderful. Thank you for that. Just one last question around plasma therapy before we take questions from the audience. How come Delhi seems to be like the epicenter of plasma therapy and the rest of India doesn't really seem to be adopting it as much? Why is that?
No, even in Bombay it's happening. Delhi and Bombay both.
Yeah.
The doctors, both ways, people are going for plasma. They have this hype about it. What I want to request here, Bhavna, is that please don't get paranoid about it and just keep on going and asking people plasma. There are medicines, only ask for plasma if your doctor asks. Otherwise don't just, what is happening? Patients are coming and they are asking us, Doctor Saab, aap plasma nahi lagwa rahe ho, hamare patient ko wo ICU mein hai. Once the patient has reached that stage where the patient is on ventilator, what will plasma do? Basically, it will only boost up. It's somebody else's antibodies in your body that will only boost up your immune system to a little certain time when the actual medicines act. You're already giving medicines, then you don't, this is not going to give you an extra boost. So, it's whole thing, it's a circle that has become now.
Thank you very much. Thank you for answering all my questions. But now we're going to take the audience questions. So does Dr. Glossy give teleconsultations for COVID? Yes, she does. What happens if you have undiagnosed C19 when you get your jab, your second jab? Then what happens?
So when you are getting, keep vaccine on one side and your infections on the other side. Your vaccine is something that is happening inside inside your body. That virus, it's either the dead virus or a part of the virus which is given inside your body so that your body makes antibodies. That is separate. Having a vaccine does not protect you from getting the infection. It can protect you from getting the disease. So there are two parts. There is infection and there is disease.
Can you please elaborate?
Yeah, so infection is that you can get infected. The virus can still be in your nose, in your throat, in your respiratory tract. It can still go down there. But progression of infection into a disease of a severe kind will not happen or will happen less if you have taken your jab. So after taking your question, like you have asked this question, that after taking the jab, if you've tested positive, of course, you can still have the infection. That's why wearing of mask is so important.
No, actually, yeah, thank you. But the question is, if you take a jab and it turns out that you had undiagnosed COVID-19, I mean, does that mean anything? Is there any implication for this? No.
See, if you have symptoms, then you should not. But it was asymptomatic, it was undiagnosed, then you obviously can't do about it. You cannot do anything about it. But yes, you will be a problem for the people, those who gave you the vaccination shot. So they all should be more worried rather than you.
Thank you, Dr. Glossy. So antibodies of 6.2, this is from Alpha, antibodies of 6.2 for a person who has not had COVID. What does that mean?
What antibodies are these? Are these the antibodies after your vaccine shot, or are these the antibodies with asymptomatic infection? Usually what is happening is that patients want to know whether they had COVID or not, because the only category of people who are not having severe COVID is the ones who had COVID before. So everybody wants to check, maybe, I think I had COVID somewhere. I had that loss of smell. I remember last year. So can I get my antibodies checked? Please don't do that. There is no way to check with the antibodies, because even if you had, your antibodies might have disappeared. So there is no way to check. Now, having antibody of 6, what does it mean? 2 types. Either vaccine, if you have not taken the vaccine and still the antibodies are there, that means you have had the infection in the past, but it doesn't carry any meaning. Like it is of no use.
Okay. Thank you. Now we've got from Mantej Kaur Ahluwalia. Hello, my husband had taken steroids. It's been 6 days back that he took steroids. His pulse rate used to be 70 to 75. Now it's around 95 to 104. Is that okay?
Now, your husband has taken steroids as a part of the COVID treatment? That's a question. Or has he taken steroids as supplements? That matters. Now, if I'm assuming, since it's a COVID background that we have, your husband took steroids as part of the COVID treatment. After that, sometimes some patients have this slight tachycardia and some have slight bradycardia. That means slight increase in the pulse, or some people have a slight decrease in the pulse. That does not matter. What is important is, if the pulse rate is high, you need to check the temperature first. Most likely it's related to your temperature in COVID. That is, the pulse rate is little high, not because of the steroids being taken.
Thank you, Glossy. Then we've got from Kiran, Dr. Glossy, how important is ventilation?
The same question had come yesterday also. Ventilation, as we discussed, that ventilation has nothing to do with the COVID infection. If you are sitting in a room, you are isolated, you are COVID positive, you have a window air conditioner, you are going to use that. But if you don't have a window air condition and it's a centrally air conditioned house, then obviously you cannot use the central air condition. You have to have a ventilation. But they say that, it should be a well ventilated room. No, for any person in quarantine or any person, I would not say in quarantine, in isolation in a room, the room should be well lit and well ventilated. Otherwise, it will be so dingy out there, I think.
Okay, thank you. Okay, now from Kritika, we've got, I wanted to check that I see people are still scared about vaccination.
Yes.
Question
people-
is, the question is, if we are asymptomatic and have COVID and we are not aware of it and get vaccinated, will it be fatal? Should we get tested prior to a vaccination?
Okay, so when we say these vaccines are pretty safe, but it is suggested that if you have any symptom, not asymptomatic, if you have any symptom of any sort of viral or any uneasiness or that feeling of being unwell, delay your vaccination. Don't rush into it. But if you are otherwise fine, you think that you get a test done before the vaccination, no, it is not required.
Okay.
Unless it's symptomatic, you don't have to worry about it.
Okay, thank you. Now we've got from Mantaj again. Please tell me the lungs revival exercise. My HRCT chest score of 10 by 25, but now recovered from COVID.
Okay, so it's very, very important that anybody who had a score of over 8 on HRCT chest at any point during their entire course of COVID infection must undergo complete physiotherapy sessions with the pulmonary specialist physiotherapists. They are available in every hospital now. Basically, our own physiotherapists have been trained to give you specific lung exercises, pranayams, yoga exercises, deep breathing, prone breathing, the correct way of doing prone breathing. All of these exercises will be very useful to prevent the scarring and the fibrosis, which eventually can lead to what we call as interstitial lung disease, which is a permanent damage to the lungs.
Okay, so means in recovery phase basically of COVID, we absolutely must do physiotherapy for the lungs. Is that what you're saying?
Absolutely.
And that is very important. It's critical so that you prevent any long-term damage. So this is a way to boost your lungs back, so to avoid any long-term damage. Is that correct?
Yes, totally.
Thank you. Scary, but I think it's very necessary. That's the main thing here. Okay, what is the importance of CT value? This is from Tanya.
The CT value of RT-PCR or the CT value of the HRCT chest?
Explain both.
Okay.
He hasn't clarified.
So
explain.
let's talk about the CT value of RT-PCR. When I get a RT-PCR report, usually it says a CT value of 20, 15, 18, 28. What does it mean? It means that when your nasal and throat swab was taken, there are cycles going in the machine that is checking for COVID virus. So if there is one cycle, it's 1, 2, COVID not detected, 3, COVID not detected, 4, COVID not, okay. Now at 10, COVID got detected. So my CT score is 10 on RT-PCR. That means I am highly infectious because the COVID came early in that cycle of 0 to 40 or whatever the limit is of the lab. But if it is coming 28, 29, 30, that means that the infectivity, the viral load was less. So it has come in that later part of the cycle. This is the main thing, the physics behind CT score of RT-PCR. But what the pathologists say and what the infectious specialists say, they say that it carries no meaning. People who have got 28 have infected 10 other in their house, and people who have got 10 have not infected anybody. So practically it has not, but that is what the physics behind it says. And then we have the CT score of HRCT chest.
Yeah, so can you just tell us what would that be for HRCT score of chest?
Yes, so when we are doing chest, that is the one which actually determines our treatment and the progression of the disease. When you are undergoing HRCT chest, it divides it into 3 categories of mild, moderate, severe. and mild is a score up to 8, 0 to 8 out of 25. More than 8, 9 score till 15 is moderate, and over 15 is till 25 is severe category. So we know when to give steroids, when to give remdesivir, when to give like the higher doses or boost it up is dependent on this problem of
Tell
the
me something. I'm just going to add to her question here. So how come some CT scores are out of 25 and some are out of 40?
So there are different classifications, Bhavna, because since COVID has been very new, so is the research. A lot of people came up with, European study was different, Asian was different, American studies were different. So what we have accepted in India is the score out of 25. That has become a standard, and that's how we go about it, so that there is absolutely no confusion.
Okay, thank you. From Sadhana, we've got, my son has had COVID twice within 8 months. What implication does that have, please, on his perspective?
See, children coming up with reinfections have been pretty common, but fortunately, so far, it's been good because kids have not had lung issues. We are keeping fingers crossed because so far the virus has shown double infection, but not a long-lasting effect on children of whatsoever, because the lungs are not affecting. See, COVID is affecting you from head to toe, everything. But the long-term effect and the maximum damage is happening to the lungs.
Okay. From Kritika, we've got also, what is the good gap for second dose of Covishield? There is confusion from the Arogya Setu app, which states that 28 to 54 days, while the media states 6 to 8 weeks.
Initially in 2020, when the vaccine was getting researched, they started saying that 4 weeks gap, 28 days gap is very good. And that's the time when Arogya Setu app also came into action. So it was fed there. All the doctors got it at 28 days, including me, myself. The whole family, we got at 28 days, we got the second jab. But then later, they realized that the immunity, the testing that they were doing with the blood after the vaccinated people, they realized that if you're giving it after 6 weeks, it's better. If you're giving it after 7 weeks, it's even better. And if you're giving it at 8 weeks, it's even better. So they decided, they came up with a consensus, and a well-researched consensus, or whatsoever period of time we have, is that the Covishield AstraZeneca vaccine between 6 to 8 weeks, you can take 6, 7, 8 weeks anytime. And if you have any symptoms, any disease, then you can even delay it to 2 weeks. There's no problem.
Okay, and it doesn't impact the efficacy?
No, it does not.
Okay. What from Rinki we've got, what can be done to build the immunity in children and adults to avoid COVID?
I wish I could answer it. I had those 5 points to say that you have this and you will be all protected. I would do that. We would never be in pandemic. At least India would not be, because our mothers have taught us to take kachi haldi, amla, all of that. But unfortunately, there is no such diet to boost up your immunity. It has been seen, as in any other viral condition, that if you increase your vitamin C and vitamin D intake, then the symptoms of viral go a little less. So infection is all there. The disease will be less severe. It's expected to be less severe. But it's not that if you intoxicate yourself with multivitamins and building immunity builders, you will not get COVID. That's not the thing. But you can, yes, build up your immunity by having all these citrus fruits which are rich in vitamin C. Yeah. Vitamin D supplements you can take to build up your immunity. Exercise is one thing which has really helped people recover also and reduce the severity of the disease. But there is no concrete thing that you take this and you won't have COVID.
Okay, wonderful. Thank you. From Aparna, we've got, my staff has COVID. Oxygen is 99. Does oxygen go over 100, and is that a problem?
Your oxygen is going over 100.
The question is from Aparna, my staff has COVID and Oxygen is 99. Yeah, and it's oxygen is 99. Does oxygen go over 100, and is that a problem?
See, if your staff has COVID, has a 99 saturation on a pulse oximeter, it's good. If it's about 100, it's good. It cannot go beyond that unless you are intoxicating the person with oxygen out of the fear. Okay, here, Bhavna, I would really write, I mean, as this question has come, today I saw two patients in the hospital with what is known as barotrauma.
What does that mean?
So people who are taking oxygen at home, like everybody is asking us, we keep oxygen cylinders. The minute they realize their pulse oximeter is showing 94, they put up that high flow and they start breathing and intoxicating with oxygen.
Oh,
So what happens? The oxygen is after all a medicine. It's a medicine to treat viral diseases like COVID-19. You cannot overdose yourself with oxygen. If you do, what will happen? The oxygen, the air goes into the subcutaneous tissues. It goes around the heart, what we call as pneumomediastinum. It goes around the lungs and compresses your lungs. So further,
counterproductive.
exactly. So you have complicated your condition at home by taking extra oxygen. So please be very, very careful here. It was something which came as a shock to us, and then all the doctors, we sat down with this problem that why has this happened? Because people are intoxicating themselves with oxygen.
Okay, just a quick question. So since we're on the topic of oxygen, and we can dive more into oxygen tomorrow, but just one quick question right now. Threshold at which one should start a concentrator or a cylinder, because we can't make it to a hospital, or the oxygen is dropping, or whatever it is. So at what stage at home, what stage of pulse oximeter reading should we start either concentrator or a cylinder, and which is preferred and why? Can you just shed light on that for a quick second?
Sure. So firstly, you are checking your pulse oximeter. As long as it's 94, 95 and over, you don't do anything. Between 90 and 95, you don't do anything. If you know you have access to the hospital, doctor, you don't panic, okay? Because see, when the pulse oximeter is showing 90 or it is showing 98, it does not matter in your blood, because in your blood that is enough oxygen. There is no problem. So 90, 91, 92, 93, 94 is okay if you have a backup of hospital. Your backup is there, the doctor is there. But if it is not there, then that's a problem. So at what phase you should start taking oxygen concentrator is when it is falling by about say 91, 90, 91. You get up, you take a little walk of 2-3 minutes, you sit down, you check again.
Okay.
If from 92 it has gone to 90, you can use the concentrator, not the cylinder. The cylinder is to be used only if it is a severe disease, hospitalization not happening, doctor is suggesting take oxygen at home while you are in the transit to the hospital, only then.
Okay. So the concentrator, since you said one can take the concentrator, right? So if somebody's taking the concentrator and there's all these levels, 1, 2, 3, 4, 5 and stuff, and everybody's saying, oh, at level 5 is at 88, and now we're putting her on oxygen. Can you explain what does that mean? What are these levels, and at what stage would you do level 1, level 2, level 3?
So Bhavna, it's nothing like a level, it's actually liter. 1 liter
Okay.
oxygen, 2 liter oxygen, 3, 4, 5.
Okay.
So
But
you
this is
start
fine.
with 5 is the maximum usually they've seen, but you can have a 10 liter one also. At 1 liter, patient is maintaining, you give a minimum dose, patient is able to sit and relax and is recovering well. We
Fine.
are expecting the patient to recover because the other medicines are going side by side along with oxygen. We prep it up to 2 because the oxygen was not maintaining. Okay, still we are giving lung support, it's okay. 3, 4, 5.
Okay, so the liters and levels are coinciding. What people are I mean, they're saying level. So level is actually represented by liter.
Liter. It's L is the liter. Yeah.
Got it. Thank you. And so now we've got from Nandini, please shed light on how safe the vaccine is for young girls of 18 to 20. Lots of different views here, conflicting views.
No, it's all safe. Anybody, everybody over the age of 18, vaccine is safe. That's what the research, and a well-researched thing it is, that it is safe to be given. So there's no problem.
Okay.
Absolutely nothing.
Thank you. And from Tanya, we've got, if you test positive, do you have to take ivermectin? Is it a must?
See, when you have tested positive, there are 3 drugs which must be taken, because what we have seen in the limited period of knowledge that we have with COVID-19, ivermectin, doxycycline, azithromycin given to the patients have recovered relatively better, have not slipped from our hands from mild to moderate to severe, but it is not always the case. Patients who have taken ivermectin also have gone into the severe disease, and patients who have taken ivermectin have also recovered.
Okay. Okay, so from Mitali, we've got, so we're out of time. It's already, we're over our half hour. So we'll just take 2 more questions and then we'll wrap it up for today, and we'll come back with you tomorrow, Dr. Jossi. So the questions are from Mitali. My husband has COVID. It's his 5th day after visible symptoms. I am absolutely fine. What are the chances that I don't get it?
Your husband is totally fine on 5th day. What are the chances that you don't get it? So if
No, my husband has COVID, from Metali. My husband has COVID. It's his 5th day after visible symptoms. I am absolutely fine. What are the chances that I don't get it?
Okay, so usually what is happening is that one person gets the symptoms. From that day, count 7th day, from the day of symptom, not the day of testing. So from the day of symptom, you said it's 5th day. The chances are that you might not have, because usually the incubation period is 5 to 6 days. So if you were with him on 1st day of his symptoms, you would have gotten, like today, tomorrow, maximum 6-7 days, you would have got something at least. If you have not, the probability is pretty less of you having it. But you have to keep yourself in quarantine, not isolation.
What's the difference between quarantine and isolation?
So there's, see, isolation is that you have tested positive, you are inside that room isolated. Quarantine is that you've been exposed to the person. So you quarantine in, so if suppose I have tested positive, so my husband and my son will be in quarantine. They will not meet other people outside. You understand? The other members in the family are quarantined. They will not meet other people, but the person who's isolated is inside. That is the one tested positive. So quarantine, exposed, isolated, tested positive.
Wonderful. Thank you so much. And that's very good for sharing everybody our understanding of isolation and quarantine. Can we take 3 more questions if you don't mind? And I think we'll be actually able to.
Sure. Let's make it quick.
Let's make it quick. Okay. Do the chances, okay, how accurate is RT-PCR? If it is negative but symptoms persist, what should we do?
You should do HRCT chest. Simple.
Okay. And then, do the chances of neurological disorder or brain stroke increase after COVID?
Yes, we have seen that mental clouding, lot of psychological and psychiatric, both the issues have been found and well researched on. It does create problems. One has to be vigilant.
Yeah. And actually, on that note, because we are talking about neurological disorders or brain stroke, we have a neurobiologist joining us on Monday. So she will be here to actually address questions around COVID and the brain, COVID and the impact on the potentiality of stroke, as well as COVID and the nervous system. So do, tune in for that. Why do we get headaches during COVID?
There are 2-3 things that cause headache in COVID. Number 1 thing, and most important, out of that box of 5 things that we said, that what happens when you feel unwell, Bhavna. You remember?
Yes.
So,
I remember.
what was the second point?
Don't panic.
Exactly. So, it's the panic that gives you the headache. I like to ask questions to Bhavna. You know, she's been asking me for last 4 days. It's the panic, the stress that is causing you tension, headache. Second, the hydration, dehydration. You're not able to smell, you're not able to taste. The water tastes different. So it's the dehydration, the medicines that you are taking. So everything clubbed together is giving you headaches. So
Okay. And the last question for today from Mr. Prem is, for asthmatic patients, is it more deadly if one gets it after a vaccination?
see, getting COVID after or before the vaccination, we have not seen, to be honest, any effect as for the severity is concerned after the vaccine.
For asthmatic patients.
Now, asthmatic patients per se are at a very higher risk as any other patient with comorbidity is. In asthma, the lung airways are involved and COVID affects those airways. So definitely anybody who has chronic obstructive lung disease, which includes asthma, is at a higher risk of getting infection. Severity of infection is more, and the after effects are more, like the fibrosis component is more in such patients. Yeah.
All right, Dr. Glossy, thank you so much. That was a wonderful interaction with you, and we look forward to having you back here tomorrow at 5:30 IST. And thank you everyone who tuned in, and please continue to join us for Need of the Hour. We will be going live every day with doctors, thought leaders, relevant people who will be bringing you on point information. Monday to Friday, 5:30 to 6. Join us with Need of the Hour, brought to you by CII IWN. Thank you so much.
Thank you, Bhavna. Thank you, everyone.
Thank
See
you. Thank you,
tomorrow.
everyone.